Hello everyone, this is Anuj Kumar studying PharmD in Gitanjali College of Pharmacy. Today I am here to explain a syndrome called as Prader-Willi syndrome. Let's understand what is Prader-Willi syndrome. Prader-Willi syndrome is a rare, complex genetic disorder affecting multiple systems in the body. A key feature of Prader-Willi syndrome is a sense of being hunger all the time. Prader-Willi syndrome, that is PWS, is caused by a loss of function of specific genes on chromosome 15. About 75% of cases occurs when part of father's chromosome 15 is deleted. In another 25% of cases, the affected person has two copies of the maternal chromosome 15 from mother and lacks the parental copy. PWS is not generally inherited, but rather the genetic changes happen during the formation of egg, sperm, or in early development. Prader-Willi syndrome has no cure. Understanding PWS is crucial for early diagnosis and effective care. Etiology. There are three main etiologies. One is chromosomal deletion, maternal uniparental disomy, imprinting defects. Chromosomal deletion. The most common cause of Prader-Willi syndrome is a deletion of the parental chromosome 15, specifically 15q11 or q13. This loss affects genes critically for normal development and metabolism. This is a normal pair of chromosome 15, one inherited from father and another one inherited from the mother. In chromosomal deletion, there is a deletion of this 15q11 or q13 part from the father's chromosome and hence leads to the Prader-Willi syndrome. Uh, 65 to 75% of cases of Prader-Willi syndrome are due to the chromosomal deletion. Maternal uniparental disomy. In some cases, individuals inherit two copies of chromosome 15 from mother instead of one from each parent, disrupting normal gene expressions. In maternal uniparental disomy, we we see that the pair of chromosome 15 inherited from the parents is not done properly. I mean, in normal pair, we can see that one is inherited from the father and another is inherited from the mother. But in maternal uniparental disomy, both the chromosomes are inherited from the mother and hence leads to Prader-Willi syndrome. It is seen in 20 to 30% of cases. Imprinting defects. It is a very rare condition. Rare crises arise from errors in genomic imprinting where genes silencing malfunctions leading to absence of parental gene activity. In imprinting defects, we can see that the chromosome part of the 50, 15q13 is either not deleted, is errored. Gene printing is errored, which leads to Prader-Willi syndrome. Pathophysiology. As we seen that this condition, Prader-Willi syndrome, is a genetic condition, there is no much pathophysiology, but what happens in a patient with Prader-Willi syndrome? We can know that. So, pathophysiology, the hypothalamic dysfunction, the role of hypothalamus. What is the role of hypothalamus? The hypothalamus, a brain region regulating hunger, thirst, temperature, and hormone release, is dysfunctional, means non-functional in individuals with Prader-Willi syndrome. This disruption or dysfunction leads to abnormal signals, satiety signals, causing insatiable appetite, hyperphagia. Hyperphagia means that the patient with Prader-Willi syndrome gets hunger all the time, even when he's eating. Hormonal imbalance is also seen. Patients also experience deficiencies in growth hormones, sex hormones, and cortisol, contributing to developmental delays, muscle weakness, and metabolic issues. Sign and symptoms. Sign and symptoms in infants. Neonatal hypotonia. Newborns with Prader-Willi syndrome exhibit markedly low muscle tone, making difficult feeding and causing weak cry and poor motor development. As we seen here that the hypothalamus function is dis- irregular or dysfunctional in neonates or infants, there is hypotonia means muscle strength is lost. We can say that the tension which helps the tension between the muscles which helps us to hold or grab is lost, so it causes difficulty in feeding and cries, causing weak cry. They cannot cry loudly. It is the initial symptoms in the infants we can see. Then feeding difficulties, as there is hypotonia, the sucking pattern of the infants gets decreased, so they cannot suck properly. So specialized feeding supports or tube feeding should is required in some cases. Developmental delays, as hypothalamus is affected, there is as hypothalamus is affected and hormones release are also affected, there is delayed development. Underdeveloped genitals, males have small penis and scrotum. The testicles may be small or not descended from the abdomen into the scrotum. This is known as cryptorchidism. In females, the clitoris and labia are maybe small. Sign and symptoms in childhood or child. Main symptom is uncontrolled appetite, which is hyperphagia. As child grow, an insatiable appetite develops, driving behaviors to seek food constantly, risking severe obesity without strict management. As there is uncontrolled appetite, which is due to the hypothalamic dysfunction, it may lead to obesity. Excess leading cause obesity. So, in order to prevent this, food security measures should be done. Families often need to secure food environments and set clear boundaries to prevent overeating and related health issues. Behavioral changes. I mean, concerns of changes. Children may exhibit tantrums, obsessive behaviors, and learning difficulties requiring psychological and educational support. Symptoms in adulthood. Obesity related risk. As we saw that there is uncontrolled appetite. If this uncontrolled appetite is not controlled, I mean overeating is not controlled, then it leads to obesity. And without proper control over the food, adults face life threatening issues including diabetes, heart disease, sleep apnea, and joint problems due to obesity. Endocrine issues. Ongoing hormone deficiencies can cause infertility, osteoporosis, and decreased muscle mass, necessitating lifelong management. As we saw that it also affects the it affects the hormone release, and there is deficiency of growth hormones, sex hormones, and other things. Endocrinal issues are also occurs, which leads to infertility as there are decreased production of release of sex hormones. Infertility can be seen. Osteoporosis is that where the bone mass or density gets decreased. Diagnosis. How can we diagnose? Clinical assessment. Initial diagnosis relies on clinical features such as hypotonia, which can be seen in infants, developmental delays, and hyperphagia observation. Main diagnosis for the Prader-Willi syndrome is hyperphagia. Molecular genetic testing. It is somewhat high, higher and most accurate test to know that a patient is suffering from Prader-Willi syndrome or not. Definitive diagnosis is confirmed by DNA methylation studies and tests identifying chromosome 15 abnormalities. Early diagnosis importance. Early recognition enables timely intervention, improving health outcomes and delay obesity onset. Management. Specialized nutrition. Calorie restricted diet with balanced nutrition help control weight and promote growth. Specialized nutrition means the patient with Prader-Willi syndrome should be given food in such a way that he is not gaining much weight, which may lead to the obesity and cause further complications. Physical therapy improves muscle tone, strength, and motor skill essentials for daily functioning. Physical therapy may be that exercises should be performed so that the muscle tone, the strength of the muscle is slowly gaining back, and he can perform all the daily functions as normal. Behavioral therapy supports emotional regulation and reduces food related obsession. Medical monitoring. Regular checkups address hormonal replacement, respiratory health, and other complications. Medic- Regular medical checkups should be done for a Prader-Willi syndrome patient so that the doctors can see know the severity and complications of the case. The patient. Prevention. Genetic counseling for families. Inheritance understanding. Families benefit from explanation about the genetic causes and recurrence risk of Prader-Willi syndrome. Family planning. Options such as prenatal diagnosis and assisted reproductive technologies are discussed to reduce incidence. Support resources. Counseling connects families with support groups and educational materials to prepare for a care challenges. Improving quality of life for individuals with Prader-Willi syndrome. How can we improve the quality of life of a Prader-Willi syndrome patient? First, main is the emotional support, providing love, patience, and psychological counseling to foster well-being. As the patient is suffering with Prader-Willi syndrome, the development of the patient is slow. So, he should be motivated or given love so that he does not get demotivated or goes into the depression. That's what the emotional support means. Nutritional management. Adhering to controlled diets to maintain healthy weight and prevent complications. Adhering to controlled diets means provide exact or accurate diet which does not cause the patient to enter obesity or lead overweight, and which reduces the further complications of the Prader-Willi syndrome. Active lifestyle, encouraging regular exercise to enhance fitness and muscle tone. Regular exercise cause can help in maintaining of the weight as well as increases in muscle tone. Education and skills, tailored learning programs promoting independence and social integration. Community inclusions, building support networks and opportunities for meaningful engagement. As Prader-Willi syndrome is a genetic condition, it does not spread from contact. So, the community should include the Prader-Willi patient in and not treat them as they are isolated or they are affected. They should not roam. The community should not do such things because it may affect the psychological state of the patient, which leads to depression and so on. So the community should not exclude them and should include them into the society. These are the reference links. If you want to know more about the Prader-Willi syndrome, just click the links and you can know more about the Prader-Willi syndrome. Thank you.